1 in 7 people will get arthritis sometime in their life, making it the #1 crippling disease. The most common types are osteoarthritis, which means the wear and tear of the cartilage, and rheumatoid arthritis, affecting all joints in the body. According to the Arthritis Foundation, nearly $9 million are wasted each year on worthless cures in Central PA alone. But what if I told you a cure could be only a supplement away? Sound too good to be true? Well, one doctor in Pittsburgh says it is true and says the proof is in his patients and bottles.
It was a few years ago when 63-year-old Fran Schneider started seeing the signs of arthritis. First, she had trouble walking, then the pain started crawling up to her shoulders. Fran was diagnosed with rheumatoid arthritis.
With the breakdown of the immune system, it seemed to make me very sensitive to any illness that came along. If I would catch a cold or something, it would take me 3 times as long to get rid of something. It seemed to affect my whole body.
It may be the sternal cartilage that's helping out.
Then her chiropractor, Dr. George Kukurin, recommended something outside of mainstream medicine. He recommended 2 herbal supplements, Unijoint and Arthro 7. Arthro 7 is mainly used to treat rheumatoid arthritis.
And the concept there is you take collagen type 2 in an oral form, and it desensitizes your white blood cells from attacking your joints. As in some cases, it actually cause complete remission of the arthritis.
The other, Unijoint, is best for osteoarthritis because it has more of the cartilage repair factors in it.
We've had great success with that, and one of the few nutritional products that we can't keep on the shelf.
In fact, this x-ray of a person who took Unijoint for more than a year shows that the cartilage actually grew back.
So you've got some separation here, if you can compare that to here where there's virtually no cartilage. So what we're showing here is some increase in cartilage where there was none before, which is very unusual. And
Can you tell me, please?
But I took this information to a rheumatologist at Kahnema's Memorial Medical Center. Dr. Ralph Tabib says not so fast.
The X-ray is a very crude and rudimentary way of telling about joint deterioration or joint building. It's an image in a mirror. You are not seeing with your eyes.
I also asked Dr. Tabib if he would ever recommend that a patient take an herb to treat arthritis. He says he doesn't reject or accept it. However, whatever he prescribes to his patients must be proven by well-recognizable medical institutions with results and possible side effects well monitored. But for Fran, she says the proof is in the bottle.
Now I'm able to wake up in the morning and get up and walk as a normal person does. And that's, to me, is a big plus, to not have that discomfort in the morning. I don't have the stiffness in my hands in the morning that I had.
Okay, well, keep taking your Unijoint, your Arthro 7, and you're about once a month now.
She also says she doesn't have the fatigue anymore, and she owes it to Unijoint, Arthro 7, and Dr. Kukurin for suggesting it in the first place.
And by the way, Fran has been taking Unijoint for about a year and Arthro 7 for about 5 months. It is such a